Center now. We're talking about something you might have right now going on, a sinus infection. Joining us this morning to talk about this is Dr. Madan Kandula from St. Joseph Regional Medical Center. My question was, do you get sinusitis when it's so cold outside? And you say, yeah.
Yeah, absolutely. This is the start of the peak season for that. So usually what happens is colds can oftentimes turn into sinus infections, and then, you know, as things turn cold, everybody's around each other, and that just keeps spreading around.
How do you know that you have a sinus infection?
It can be pretty hard to figure out. A lot of the same symptoms that people have when they have colds, they get them when they have sinus infections. If you get a cold that just keeps lingering on, it quite well may be a sinus infection.
And I know a lot of people are walking around and they're losing their voices, and you say that's a common thing that happens.
It can be. There's something called chronic sinusitis, is when you get an infection that sort of sets up shop in the sinuses and creates drainage, and one of the symptoms that you can have is losing your voice or cough or other things like that.
So how do you diagnose it?
Again, it's real tricky, actually. So you have to first realize that it might be going on, and again, it's sort of the same symptoms. A CAT scan of the sinuses is something we can use in certain situations when it gets tricky to try to figure it out.
So what's the treatment? Antibiotics, I would guess?
Yeah, the first line treatment is antibiotics and medicines to try to get the sinus openings open. Yeah.
What about people that I know some that get it all the time? I mean, are there surgical?
Yeah, and that's actually nowadays the surgeries for sinus surgery have come a long way. So back in the day, it used to be a lot more invasive and a lot more recovery time required. Nowadays, the surgeries, we're able to use endoscopes, which are little cameras, to look at the sinus openings, make them a little bit wider open, and create drainage, and the recovery is a lot easier for patients.
Who do you recommend look at the surgical option?
People who are getting multiple sinus infections, so probably more than 3 a year, and also people who have chronic symptoms where just they have a stuffy nose, a chronically runny or drainy nose, and people who lose their voice and other things from sinus infections.
Is there any way to prevent getting a sinus infection?
The only thing you can do is try to prevent the colds and things like that, which is easier said than done.
Yeah.
So not really. I mean, it's one of those things that if it's going to happen to you, oftentimes it's just going to happen.
Are there folks that are just prone to sinusitis?
Yeah, and what it is, there's 4 sets of sinuses around the nose, and each of those has openings into the nose, and some people just have smaller openings than others. Those tend to be the people who get the recurrent infections and the chronic infections, and so those are the people that are most benefited when we get things open.
The chronic sufferers, yeah, how do they fare after they have the procedure?
Very well, actually. Usually once we get the plumbing working properly, they do extraordinarily well.
That's a good way to put it. You're a plumber.
Exactly.
Okay, thank you a lot. Have a good holiday if I don't see you.
Thank you.